Hello, my name is John. Welcome to my presentation of benefits of the electronic health record. In front of you, I have two images of two of the most commonly seen electronic health records today in healthcare. We have Cerner and we have Epic. Most of my experience is with Epic. I currently work with Epic right now. I have not worked with Cerner yet. I personally really enjoy Epic. It's easy. It takes me out of the chart and keeps me at the bedside, which is where I need to be, especially when I'm taking care of critically ill patients. Things that I'm going to cover during this presentation are potential concerns that nursing has, augmentation, automation, medication tracking, and additional benefits. I will get more into this as we go along. Potential concerns. I think before we get into any of the benefits of it, we need to talk about what nurses have as concerns going forward with an electronic health record. According to one study, Furlong completed interviews to collect information about nurses' perspective of the electronic health record. There was confusion on the EHR use. Nurses felt it lacked interpersonal engagement with the patients. The solutions that were proposed were to have specific training of the electronic health record, and throughout that training, that trainer needs to emphasize on how using the electronic health record will actually increase interpersonal communication with them and the patient rather than decrease that engagement. Augmentation. According to Harrington, 2016, augmentation begins by looking at what people do in a given job and adds value to the work through the use of technology. Augmentation is best for creating greater value and enhancing patients' experience when going digital. I'm going to get into examples of this. Augmentation increases positive patient experience. It reduces patient length of stay, which is always something that we're looking for in today's healthcare. It reduces readmission rates, and it streamlines decisions within the healthcare team. Automation. Again, according to Harrington, this uses technology to manage a process better, thereby reducing human involvement to a minimum. An example with this looks at people. This looks at what people do in a given job and subtracts the work by automating it to essentially giving the work to technology. Some specific examples of this would be increases work performance. An example of that would be the nursing work list. I'm going to talk about Epic because that's what I know. So nurses' work list is a set of tasks nursing needs to complete throughout the day. And what's really great about this is as long as the nurse completes those specific tasks throughout the day, everything that the patient requires will get done. Decreases workload. Examples of this would be medication calculation, such as going into the MAR, scanning a medication, titrating medications. Epic will automatically show you the titration. It will show you the medication calculation if you need to go from milligrams to milliliters. It will automatically do that for the nurse, thereby decreasing medication errors and increasing the nurse's ability to care for the patient rather than thinking about what they need to do what medication they need to give and how much they need to give it by calculating it and being nervous that they might be wrong, their math might be wrong. It's really nice having the system do that calculation for you. Copy and paste charting. Sometimes this can get nurses into trouble if they're just copy and pasting one assessment over to the next assessment. But when you have charting that needs to get done maybe every 15 minutes sometimes, or every 30 minutes or every hour, sometimes if that assessment hasn't changed, it's really nice to be able to go in there, copy and paste exactly what you had. Again, taking nursing away from the chart and keeping them at the bedside. Medication tracking. Essentially what this is communication between nursing and pharmacy. The benefit of the electronic health record is the ability to track patients' medication. Peake, Campbell, and Kelm, these were 3 pharmacists who evaluated the impact of having data from dose tracking technology. This reduces the med request per dispense. It increases nurses' satisfaction of access to information about medications, and nurses were more likely to use the med tracking to answer questions about the status of a med rec. So examples would be if a nurse needs a medication such as, let's just go with Levofed, a nurse is able to go in the system and essentially send a text message to pharmacy telling pharmacy what medication they need, when they need it, and they can give it a low value, a regular value, and a high value. So if a nurse requests a medication like Levofed, they might need that medication very quickly because the patient's blood pressures might be dropping and they need it quick. So a nurse can rec for that medication at a high level, and pharmacy will get that at the top of their list, so then they can get that done as quickly as possible so the patient can get that medication in them. And then pharmacy can and send a text message, essentially a text message back to the nurse, and the nurse can check in the patient's MAR to see if pharmacy has seen the message and then what they're doing about that medication. So again, this streamlines communication. Without this, once again, takes nursing away from the chart and in on the bedside. Additional benefits. According to Bally, Chadwick, Mann, and Brooke Reed in 2012, they discussed additional benefits of the electronic health record. And 3 of them stuck out to me specifically was continuity of care. An example of this would be on transfers, whether that would be inter-hospital transfers or it would be from one unit to another. The ability to see the medical record from one unit to another just streamlines the care for the patient. Quality of care, again, keeping nurses, I've been saying this throughout the whole presentation, this is keeping nurses more at the bedside and not charting. And then safety, we'll talk, safety is medication errors. This decreases medication errors. To summarize everything that I went over, adequate training is definitely needed to have a successful implementation of an electronic health record. It increases positive patient experience, it reduces patient length of stay, reduces readmission rates, it streamlines decisions, increases work performance, it decreases workload, it increases communication between nursing and pharmacy, and it increases continuity of care, quality, and safety. These were my 4 references that I used. Thank you for listening. I hope you enjoyed it.